What are the common causes of back pain? What are the signs and symptoms you have to watch for? And what we should be doing and what we shouldn't be doing? Let's get into the video. Howdy guys, this is Karthik. Welcome to my channel, Karthik Physio. Back pain can be caused by several reasons. It can be due to a mechanical reason, which is we term it as mechanical back pain. Or it could be an internal reason, which something going on in the spine or the discs or the facet joints or any other structure which is in the spine. The third reason would be something which is going on in the system. Could be kidneys, organs of our body. Mechanical pain is straightforward. Repetitive stress to the back. Practicing poor posture for prolonged times. Lifting weights in an inappropriate way. So these things can cause abdominal stress on your back, most likely the lower back, and can cause pain. Is the internal reason. If somebody have a disc bulge or a disc prolapse or a spinal stenosis, which is narrowing out the spinal canal, that can cause compression on the nerve root. The pain coming from the organ is usually from the kidneys because of kidney stones or urinary tract infections, or in rare cases it could be due to a tumor or a space occupying lesion. The internal reasons can be treated mechanically as well as therapeutically, and sometimes it may need surgery. The internal reasons like disc bulge or spinal stenosis can be treated effectively by therapeutic modalities and manual therapy. The cause of the pain has to be treated. Usually the mechanical pain can be treated by lifestyle modifications. For example, if someone is working and sitting for longer times, we need to look at the workstation, we need to see the computer setup. If it is an internal reason, that means it has to be treated by an expert like a physiotherapist. So how to identify where the pain comes from? If the pain goes from your back to your legs, any one of the leg, this pain can be localized and then can be sharp and with different kind of symptoms like a pins and needles or numbness. The mechanical pain can be identified by modifying positions which can cause stress to your back, and the pain goes away or the pain goes down gradually. The second one is undue stress on the discs or the nerve roots. Once the compression or the irritation goes away, that pain goes away too. Usually the nerve pain can pronounce as numbness, tingling, pins and needles, sometimes a loss of sensation on the legs if it's in the lower back. The pain which is coming from an organ is usually dull in nature and it is constant, and it can be vague and very poorly localized. So how to identify this pain? Usually if the pain comes from an organ or because of a tumor or something, it may have some associated symptoms. For example, if somebody have an infection, then they can have an accompanied fever, raise in body temperature, and then malaise, fatigue, and all those stuff. If it's from a kidney stone, then what happens is the pain is dull too, and the pain can become sharp, and the pain can be relieved sometimes by applying pressure on that specific area. The tumor, which is present inside, this can cause pain, weight loss, loss of appetite, and so many other associated factors if the tumor or the cancer is spread towards other parts of the body. What you want to actually do if you see an acute pain, you want to see that there is pain, any swelling, and important thing to watch for is if the pain modifies when you change your body position. But some people, if you stand up, you feel like the pain goes away a little bit or feels better than sitting down. Sitting down is better than standing up, or lying on the side is better than lying on your back. So these things matter. So usually the mechanical pain or the internal pain can change with the change of body position. You want to watch for pain and swelling and the warmth. The swelling is very rare, so you want to watch for any lumps there. The first thing to treat with ice if it's an acute pain for the first 72 hours. 15 minutes, 3 to 4 times a day. That's the best option to do. And the don'ts is people usually take long bed rest. So the bed rest is not naturally advised for people with low back pain for more than 3 days. So if the pain doesn't go away in 3 days, it needs to be checked out by a professional like a physiotherapist or an orthopedician. And the don'ts, definitely the heat is not an answer for an acute pain. So I wouldn't even go there because this can increase the inflammation and the pain as well. And applying some heat rubs, that's another no-no for an acute pain. Self-medication for a long time, over-the-counter medications, which can just mask your pain but don't treat the cause of the pain. So for a few days, the pain changes and it goes away, it's fine. But more than 4 days of over-counter self-medication is not advisable. After 3-4 days, if the pain doesn't change, seek advice from a physiotherapist. And then the physiotherapist can treat you with modalities and manual therapy, and they possibly find the reason where the pain exactly coming from, and further referrals can be made as needed. This video is intended to give an idea about what may be the cause of the pain and what are the symptoms to watch for. I hope this video is helpful for you, and in the coming videos we are going to see more about back pain and its treatment programs which you can do at home in a safe manner. If you find value in this video, please hit the like button. Feel free to share this video and subscribe for more videos like this. Till I see you again in the next video, thanks and bye from Karthik. Have a nice day, guys.